opening of those two new mass vaccination sites today, there is still the issue of how to get those shots into the arms of homebound seniors. While Citymeals on Wheels, which delivers food to the homebound elderly, may actually have an answer. Executive Director Beth Shapiro is here to share with us what they are cooking up. Good morning. Thanks for being with us.
Thank you for having me. Good morning.
Absolutely. So since the start of this COVID crisis, Citymeals on Wheels has been on the front lines, delivering over 2.5 million meals to homebound seniors. And since, you guys are in contact with such a vulnerable population, is your staff, are they all vaccinated?
Actually, no. It's a real challenge for us that meal delivers and kitchen staff have not been yet been approved for the vaccine. We're talking only 600 people who are going into the homes of homebound elderly New Yorkers. They need to be prioritized to get vaccinated.
Absolutely. Okay, so that's one fold. The other thing is vaccine distribution across the 5 boroughs has been an uphill battle, which which is part of the reason why your folks can't get the vaccine. First, there was a supply problem, then the weather forcing vaccine sites to shut down. So how can Citymeals be actually an asset to the city when it comes to vaccine distribution for seniors?
There are several ways. The first is education, educating older New Yorkers how important it is to get vaccinated and putting information out in multiple languages, calls to them, leveraging our volunteer network to help do that. And also then really putting in place mechanisms to get older people to senior centers, open senior centers up as pop-ups. That's where people feel comfortable, safe. It's simple to do. It's not mass numbers. And we need to look at the homebound, being able to leverage EMT services, home care workers, and even our refrigerated delivery trucks can carry vaccines with volunteers and workers who can help vaccinate people. We've got to educate them. We've got to get
Beth,
appointments set up.
I need to stop you really quickly because Governor Andrew. I want to get back to my interview with Beth Shapiro. Beth, you've been listening to that, and we're talking so much, not only the governor, but others, about the importance of the vaccine. So help us understand, you had talked about possibly providing your refrigerated trucks to carry some of the vaccine. Would you also have medical staff going with your volunteers into these homebound seniors' places?
That would be our recommendation. Our volunteers can't administer, nor could our staff delivers administer the vaccine. But there are plenty of medical staff who can. And if they're going into an apartment with someone who is familiar to the older person, it is a much easier process. It's comfortable. It's safe. We need to get them educated. We need to schedule appointments well in advance and have a system in place that is usable for them. It's not complicated. They don't all have internet. And even the phone system is difficult. So we just need to take special measures to make sure they're vaccinated. Look, 8 in 10 of those who have died from COVID have been older people.
Right.
It is critical that we think about them and keep them in their homes where they're safe, where they can't get out, many of them. And those who are able-bodied, get them to pop-ups where they are comfortable to get vaccinated.
You have the resources, you have the relationships with these homebound seniors in order to make this happen. Hopefully it can be something that we'll see in the future because, as you said, it is imperative as these seniors, look dead in the eyes of this pandemic and know that vaccine is, as we heard from the governor, the way forward. So thank you so much for speaking with us today.
Thank you for having me.
Beth Shapiro, the Executive Director of Citymeals on Wheels.